Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little better. My name is Phil George. I'm a clinical biochemist, a certified personal trainer, and a health coach. Please remember that everything we discuss in the show is for informational purposes only and should not be taken as medical advice. Always seek the guidance of your medical professional. So I have a radio show also at WCRN, and that's converted over to a podcast. So if you go online, just type in Wellness Wave Radio. This show will be converted to YouTube. It goes on YouTube. So we have all of the past episodes. Everything we do is in the past. All the guests we've had on and things like that. But the other thing I do on the radio show, and you guys are welcome to do it. People email me questions about different medical conditions, and I answer them on the air. I don't mention the person's name for confidentiality, but that's what I do. So if you have any medical questions or you want a second opinion, feel free to email me, philgeorge@charter.net, and I'll read it on the air either here and even sometimes. In fact, the way I'm going to do with this one, I have my radio show is on Saturday and Sunday, 7 to 8 on WCRN. And what I do is I'm going to actually go over this high blood pressure issue now, but I'm also going to be doing the same show on the radio because this gentleman that emailed me, I told him I'm going to send him actually the video of this so he can watch it because it gets a lot more involved. High blood pressure obviously is a big issue, so it's not just one person. And normally, if you have a question, I can guarantee you thousands of other people have the question. In fact, I just heard in terms of, this is converted over to Dreamvisions 7, and I get a monthly report about subscribers and stuff. So we're up to 70,000 people actually download these issues. So this goes out pretty wide. So I kind of get the chance to spread the information. So what I want to do, I want to just read the email I got from this gentleman. We've been going back and forth. He's basically a client at this point, asking me different medical questions. So he emailed me. I need more information. So this is what this is based on. Several emails that we went back and forth. And it says, "Morning, Phil." And I asked him, "What was your latest blood pressure readings?" He says, "My blood pressure readings for 4 days. So one day it was one. It's just to let you know." A normal blood pressure, they consider normal blood pressure, 120 over 80 is normal. So his blood pressure was, just back up again. So there's two parts to blood pressure readings. One of them is called systolic. And what systolic means is how much pressure when your heart beats, when it pushes the blood through your arteries, through your veins. That's your systolic. So obviously that's going to be a higher number because it's going through there. You can imagine based like a hose, like a water hose. When your water's going through it, imagine the water's pulsing through it. So when it's pulsing through it, it's dilating the hose. In your case, it's dilating your blood vessels, and then the diastolic is when there's no more pressure and it's at rest. So that's this diastolic. So the systolic is the top number, and that's when the heart's beating. Your heart, beats, and the latest, it's 72 beats per minute is average. So each time that beats, it pushes blood through it and it dilates the blood vessels. The systolic, when it's at rest, there's no blood going through it. So his systolic was one of them was 166 over 62. So that's high. Remember, 120 is normal. So 166 is pretty high. The 62 is below normal, okay? And this is pretty much gone through for his 4 days that he's tested it. The next one was 162 over 66. The third one was 143 over 57, and the last one was 141 over 63. So his diastolic is normal, but his systolic is high. In fact, there is a very specific name for this type of high blood pressure, and it's called isolated systolic hypertension. Hypertension means it's high, hyper high. Hypotension means it's low. And actually, a lot of people don't realize, but actually your hypotension could be more dangerous than hypertension because what happens is, if you think about it, if your blood pressure is too low, you're not getting blood to your brain, other parts of your organs. The other thing, you're not getting blood into your brain. If you don't get blood into your brain, you could pass out. In fact, I knew one gentleman who had his carotid arteries cleaned out. But before that, his blood pressure was high. And I saw this gentleman, and what happened with he said, geez, my blood pressure has really dropped low. And the reason for that, I mentioned to him, one of the problems could be before, again, his arteries were clogged up. You didn't get much going through. So what's happening, it's raising his blood pressure, but he was taking hypertensive medications to lower his blood pressure. But now that his arteries are cleaned out, the blood's going through them more. It's going through them more easily. So what's happened now? He could have hypotension. In fact, he mentioned to me he get dizzy sometimes. So you have to be really careful with blood pressure medications, because if all of a sudden you're taking too much or it's not the right dose, what could happen is you could get really dizzy. You could pass out, fall down, bump your head, all kinds of stuff like that. So hypotension, low blood pressure, can be dangerous also. So it's not like you don't want to get it too low. So you have to be a little bit careful on that. But this gentleman has got what they call isolated systolic hypertension. And I'm going to address this later on. But for most people, this is a relatively unusual pathology, illness. It doesn't happen to many people. I'll deal with this a little bit later on, but I want to deal with it directly. So one thing you want to do, the best investment you can make is to get a blood pressure cuff. You can get them at CVS, anywhere else, and they're like $30, $40. It's very inexpensive. What I like about this, I like to call it one and done. If you're taking medications, you're taking supplements, you're buying them over and over again, there's a constant cost to that. But if you're getting one thing, you buy it once. I have a blood pressure monitor at home, and I bought it like 10 years ago, and it still works fine. Everything, just changed the batteries once in a while. So a common question I get with clients is, how should I take? Where should I take? When should I take my blood pressure? Well, let me just back up. I have a friend at the gym, and this guy's in great shape. On no meds or anything else. And we get to talking. He says, it's odd. He says, because what happens, and he has a blood pressure cuff at home. My blood pressure is normal at home. Everything's wonderful, no problems. When he goes to see the physician, they take his blood pressure, and it's through the roof. And there's a condition called white coat hypertension. All that means is you're nervous. You go to see the doctor. You wonder, what's my blood pressure going to be? It raises your cortisol. The stress hormone raises your blood pressure. So it's not good to just base, in other words, if you see the doctor and your blood pressure is above 120 over 80, or let's say it's 140 over, 140 over 100 or something, it's really, really high, the doctor may wind up putting you on a blood pressure medication. I was mentioning to Art before the show, I had Dr. Donna Bartlett on the show several times. She was sitting right here. And she'll tell you any kind of medication, there's a side effect to it. I had one client. There's a specific type of hypertensive medication that affects your kidneys, and the side effect of that is a chronic cough. So that's pretty annoying. Giving a cough over and over again to lower the blood pressure. So obviously, I don't take any medications. Again, I'm not a physician. This is not medical advice. But my goal when I'm dealing with the client is to basically find out what's the cause of the medication. The joke I make with most doctors, allopathic or Western medical doctors, it's diagnose and adios. They get 12 to 15 minutes to spend with you. They don't got much time. Your blood pressure's there. Easy solution, give you a blood pressure med. If that blood pressure med, your bad side effects, they'll put you on another blood pressure med. But as a biochemist, I want to know what's called mechanism of action. What's causing the high blood pressure? Okay, let's try to fix the cause as opposed to just throwing a drug at you. So effectively what they call most hypertension or high blood pressure is what they call idiopathic. Idiopathic means we don't know what's causing it. But we're going to it's easy for us to give you a medication and get it down, okay? I like to treat clients what's causing the hypertension. Is it something you're eating? In fact, most high blood pressure is caused by something called insulin resistance. Insulin resistance means your A1C, hemoglobin A1C, all that means is it's a 3-month snapshot of what your blood pressure is, what your blood sugar is over a period of time. So a lot of times it's caused by basically insulin resistance or high blood sugar. And little aside, the way that happens is if you have a lot of high blood pressure, I keep saying blood pressure. If you have a lot of high glucose in your body, it does something called glycation. All glycation means, an example, if you have a bacon, bacon in the beginning or toast, it's very loose in the beginning, but if you cook it, and the more you cook it, the more brittle it gets, so now you can snap the bacon in half, or if you're making toast, you can snap the bread in half. That's called glycation. It changes the composition of the bacon or of the bread. So that's a problem. The same thing happens in your body. If you're eating a lot of sugar and your body can't clear the sugar because of the insulin resistance, it goes into your different proteins in your body and it causes glycation. So I like to say you're cooking yourself from the inside out, like you're cooking a piece of bacon. So your proteins, they get very rigid and they don't work very well. And that's actually what they do with the hemoglobin A1C. It's the measure of how much glycation, or what happens, it's called denaturing. You're changing the chemical composition of your red blood cells. That's not good because they can't get around the way they're supposed to. So that's why insulin resistance actually can cause hypertension. So when I have a client, what I'll deal with, I'll try to change their diet in terms of, so they get their blood sugar back to normal. A lot of times, just by getting your blood sugar back to normal, it can fix the hypertension. Okay, we're doing two things. We're preventing you from getting type 2 diabetes, and number two, we're also you're lowering your, so you get a twofer there. You get two for the price of one. So if we can fix the insulin resistance, we can fix a lot of other things too. Because if you wind up with insulin resistance, type 2 diabetes, that causes a lot of problems. You can get foot ulcers, you can get vision problems, all kinds of stuff. So you've got to be careful in terms of, again, insulin resistance causes a lot of downstream problems. So that's one of the issues. So going back to point one, when should you take? Let me back up to my friend. So my friend, they couldn't figure out what was going on with them. So I told them, I said, you could have what they call white coat hypertension. So he found out later on, the problem was not even his white coat hypertension. They were using the wrong size blood pressure cuff on him. In fact, he kept on talking to his doctor. Doc, this makes no sense. The doc, you know what? I think we're using the wrong. This guy's got big biceps, so they were using the wrong blood pressure. When they put the correct, because if you're skinny, if you got little arms like this, is a different blood pressure cuff than if you got big arms. So you got to use the right blood pressure cuff. Sure enough, they were using the wrong blood pressure cuff on him, and they could have easily put him on a blood pressure med that he didn't need. So that kind of solved that problem. What I do is when I go see my doctor or my dermatologist or whatever, sometimes what they'll do is they'll take your blood pressure. Now, what I do, and my advice to you guys, I'm going to try to give you one suggestion to make your life a little better. I never use the elevator. And I have an ear, nose, and throat doctor that I see for various things. And what I do is it's 3 flights up. So I walk up the stairs because I want to get exercise. So don't take the elevator. Most of your exercise what happens outside the gym, not in the gym. So if you hate going to the gym, just go up and down the stairs. What it'll do, it'll give you a good little workout. So I'm walking up 3 flights of stairs. I'm in pretty good shape. I go to the gym just about every day, so I'm in pretty good shape. But I'm walking 3 flights of stairs. What happens? I sit down, the nurse comes in, puts the blood pressure cuff on me, and your blood pressure is elevated. And I say, no kidding, it's elevated. I just walked up 3 flights of stairs. Okay, so you got to wait until your blood pressure gets back to normal. So my suggestion to you guys, your blood pressure cuff, the best time to take it is first thing in the morning. That gives you a baseline. So what I do is, what you do is you get your blood pressure cuff, you put it on, you get it ready to go, you don't turn it on. Look at the clock, wait 1 minute. Give you a chance, because remember, you're walking around, you're waking up, also do it before you drink your first cup of coffee. because your coffee will raise your cortisol levels. That's going to raise your blood pressure. Okay, so you want a resting blood pressure. Okay, so that's what you want. So put it on, get ready to go. Don't turn it on. Look at your clock. Wait 1 minute, then turn it on, and then see what it is. That's going to give you a pretty accurate blood pressure, reading. And if that's a little bit high, maybe throughout the day, but each time you take your blood pressure, give yourself 1 minute to sit there and allow it to get back to normal. Because again, I don't want you guys to go on blood pressure meds if you don't need it. Because we talked before, if your blood pressure gets too low, you could pass out, fall down, break your hip or something like that. So you got to be careful with that. So you can't go all the time by what it's at the doctor's office, because again, you could have white coat hypertension because you're worried, again, what's going on with it. So take your blood pressure several times throughout the day to see what's going on with it. So if you do have hypertension, the first thing you're going to want to do is you're going to want to look into your diet, look into your hemoglobin A1C. So I'm a clinical biochemist, so that just means my undergrad's in biochemistry, but I got another degree, and it's called clinical biochemistry. What that means, I worked at Holden Hospital for 20 years, and I worked in the lab. So I actually train medical students on clinical procedures and what to do with this. So when a client comes to me, what I do, the first thing I do with them is I look at, give me your lab work for the last 3 years, or your most recent lab work. And then what I do is that if you're going to go see your doctor, email me, philgeorge@charter.net. I'll give you some lab tests that probably not going to order. One of them we talked about, hemoglobin A1C, which is a measure of 3 months worth of how well your body is using glucose. A lot of times doctors won't do that. And there's other tests, homocysteine, and again, that's a whole other show, but there's other tests your doctor's not normally going to order that'll give you a pretty good idea of your health status. So remember, when you wake up in the morning, get yourself a blood pressure cuff. Maybe do it several times throughout the day. But again, if you're running around, you're excited, and you're drinking coffee and stuff like that, you want it to be where you're not getting any type of anything that's raising it abnormal. You want a resting blood pressure. So the issue here is, the other thing is what's going to raise your blood pressure is obviously your arteries. So if your arteries are starting to get clogged up, again, going to the analogy, if you have a water hose, or even better, so you got your tap, you want to get water out of your tap, and you turn it on and it's going, you notice that water is getting less and less coming out. If you live in a place where you have well water and things like that, you could have a lot of different minerals in there, and the minerals can wind up clogging up your pipe. So that's kind of like your pipes over here. They get getting clogged up with bad cholesterol. Cholesterol is a whole other show. Different things getting inside of there, and it gets smaller and smaller. That raises your blood pressure because, again, the water, because your blood can't get through it, and it raises your blood pressure. So one thing you may want to do is you want to know what's called your carotid arteries, which are right here, if those are getting clogged up. And they've done studies of people as they get older, and what they found out, the number one fear people has is not of cancer or heart attack. The number one fear they have is basically having a stroke. Because then basically, you're in bad shape. Your arm doesn't work, you can't get around, you can't think, you could get damage to your brain. So that's why you want nice clean arteries. We had Dr. Eddie Arus, he's one of the top vascular surgeons. I had him on the show several times. He talks a lot about that, about you want to keep your arteries clean, and there's different ways of doing that. Again, feel free to email me, philgeorge@charter.net. So the problem, a lot of people think the problem is eating a lot of fat. Fat's not the problem. The problem is insulin resistance or the blood sugar. That causes the glycation. In fact, it's called AGEs, advanced glycation end products. Easy to remember, AGE. As you're aging, that's getting clogged up more and more. It's not due to the fat. It's due to what they call oxidation in the arteries. The way that works is this. Remember we talked before about the bacon being nice and loose? That's like your arteries being nice and loose, no problem. But what happens if you have this glycation inside the arteries, what happens, it causes a lot of oxidation to where then what happened, the fat starts sticking in there. So that's the problem. It's not the fat that's causing it. It's causing oxidation. Oxidation just means, technical term, loss of an electron. So if you have a car, right, and you have an old car, and all of a sudden you get a lot of water on it, and then the paint starts wearing away, what will happen is you'll get rust. That's called oxidation. It's taking away, losing electrons out of the paint, and all of a sudden you get holes in there. The same thing that happens to your arteries. What happens, it gets worn away a little bit at a time. While I'm on that subject, you guys have probably heard of vitamin D, really important, vitamin D3, because one of the things the vitamin D does, it takes calcium and it puts it into your blood vessels. The problem with that could be the calcium can go into one or two places, or one or three places. It can go into your bones, which you need. It can go into your teeth, which you need, but it can also go into your arteries. You don't want it in your arteries. So if you're going to take vitamin D, you'll want to take vitamin K2 along with it. What vitamin K2 does is it tells the calcium to go into your teeth and your bones and not into your arteries. In fact, there's been studies done that taking K2 on its own can decalcify your arteries. So when I have clients that have again with the carotids, when they have a calcification in there, they can do that with a couple of different tests. One of them is called a calcium and artery score, where they do kind of like an MRI. They can see how much calcification you have in your arteries. They usually look at your carotids. But a poor man's way of doing it, the doctor, when he has the stethoscope, he goes and listens to your heart and stuff, ask them if they can put it up to your carotids. They can hear this whoosh, whoosh, whoosh. It has, and I had Dr. Roos on the show, the vascular surgeon. He has a name for it, I can't remember what it is, but there's a very specific sound that a doctor can hear, that you've got a little bit of narrowing of the carotids in there. So Doc, can you check my carotids? Or just point, if you can't remember carotid, just point here. Doc, can you check that, see if that sounds okay? He can start telling ahead of time, maybe if you're starting getting some calcification in the arteries, okay? But what I like to do with clients is I want to prevent the problem before it happens. So if you don't have time to do that, just get some K2 along with your D3 or K2 on its own. There's different types of K2. Again, this is my field. You've got to be a little careful with that. So feel free to email me, philgeorge@charter.net. I have a trusted supplier, because supplements are a tricky business. A lot of them made in China and India. China's not our friend. They're out to make as much money as they possibly can. So they may give you not the best form, or maybe it's not, K2 may not even be in there. You don't know what's in that supplement. I know what's in the supplement because it's third-party tested. So I'm careful where I get my supplements, okay? You don't want to go with the cheapest supplement at Walmart or wherever. You want to know what's inside that supplement. People constantly are sending me things, is this supplement good? Is that supplement good? And this is my field. This is what I look at. So again, feel free to email me, philgeorge@charter.net. I have one company I use. They test it. I double test it. I make sure it's third party tested. So that's one takeaway. You want K2 along with the D3, because D3, you need D3. Most people are deficient. We live in New England. Most of the D3 comes from the sun. We don't get much sun, and some people don't even take vitamin D supplements. The other thing, what I do with a lot of doctors don't order what they call vitamin D levels. So getting back to vitamin D, when the whole COVID thing came out, they found that people that had vitamin D levels below 40 international units, what happened is they were much worse outcomes because vitamin D also has a lot of other good stuff with you. So I have all my clients get a vitamin D level, make sure it's above 40, okay? You've got to be careful too. You don't want too much vitamin D. You can get a little bit into vitamin D toxicity. So you've got to be in a pretty good range with there. So most doctors don't order a vitamin D level. So you want a vitamin D, you want the homocysteine, you want you don't really have to test on K2. It's kind of a tricky test. So these are all things you have to watch out for. So again, with this gentleman, what I'm going to recommend again is I'm a little concerned because I don't know if he's got calcification in his arteries. You got to be careful with that. The other one you can do, I'm making some notes here. The other one they're gonna tell you. So we came across the whole white coat thing. They're gonna tell you to go on a low salt diet. This is a very controversial subject. There's a book I read. It's called The Salt Fix by Nicholas D'Antonio. And what he said is sometimes if you need salt, I mean, we need salt in our body. So if you go too low on salt, you could have a problem. But some people are sensitive to salt. So a little bit of salt may raise your blood pressure. So these are all things, it's not one size fits all. So when I meet with a client, again, I give them basically the disclaimer, this is not medical advice. You're different than I am. I said, but if I were you, but I'm not you, you have different genetics than I do, what I would do is I would do this particular diet. But again, you can't change what you don't measure. So one of the things you want is, again, you want that blood pressure cuff to make sure to know what's going on with it. So very high blood pressure is dangerous. Very low blood pressure is dangerous. So again, do yourself a favor, get yourself a blood pressure cuff, and start measuring it. Each morning. Easy to do. There's a really good book by James Clear called Atomic Habits, and he talks about getting into habits. So get up in the morning, maybe even before you go to bed at night, to give you the clue. Get your blood pressure cuff, put it on the table. You wake up, oh yeah, this is my blood pressure cuff. I got to take my blood pressure. Then you have your cup of coffee, and maybe later in the day, maybe before you go to bed, check it again. So have an idea of what's going on. The other thing is, if you're on blood pressure medications, maybe you don't need the blood pressure medications. Maybe you're okay. So again, all drugs have side effects. So and plus there's co-pays with these things. So maybe save yourself a couple of bucks, and maybe when you go back to see your physician, say, Doc, you know what? I've been checking my blood pressure and it's really good. Do I really need to stay on this medication? Because there's another thing. Dr. Donna Bartlett had on the show, teaches pharmacy at Mass School of Pharmacy. She calls it polypharmacy. I think the average person above 60 now is there 5 or 6 medications. They get a whole thing, they're taking this, they're taking that, there's interactions. So the other thing, again, the doctor's got 12, 15 minutes to sit with you. You may, a lot of times they have a thing you can actually email them and say, look at doc, I'm taking this medication. Do I really need to take all these medications? Or even better, Dr. Donna Bartlett, she teaches this stuff. What she talks about, she does a consult. So if you want, email me, philgeorge@charter.net. I'll give you an intro. And what she'll do is she'll look at all of your drugs, and she'll say, this is interacting with this does this does that. Maybe you don't need this, and this. I'm not a pharmacist, okay, but I mean, she is. She teaches this stuff. She teaches doctors and stuff. The other thing that Dr. Donna talked about, she says, you got to understand that, and I think she says the average doctor has one course in pharmacology at school, so in medical school. So they got very limited knowledge in terms of different types of drugs. Good example, if you're how much time we got left? 2 minutes, okay. So again, it's worth the money. I think I can't quote this. It's like about $100. She'll take all your stuff, she'll look at it, and she'll do consults with you. Because whatever you're doing with your co-pays, you're paying into that over and over again. Pay once, see Dr. Donna, email me, philgeorge@charter.net. I'll give you a personal introduction to her. I think it's worth it. Because I don't know what your drugs are costing you, but again, there's side effects, statins, all the rest of this stuff that you're taking. Maybe you don't need them. I don't know, but I'm saying taking all these drugs over and over again, I mean, your co-pays and everything else. So that's one thing. The other big one is called nitric oxide. So what happens, nitric oxide, if you've had a heart attack, they give you something called nitroglycerin, like the blow-up stuff. They'll inject it in you. What it does is it vasodilates all of your blood vessels. So you can take nitric oxide, they're lozenges, and I take it, put it on my tongue, I take it several times a day. What it does, and my blood pressure is normal, by the way, it opens up your blood vessels, and it gets more blood into all different parts of your body. So again, you've got to be careful with this. There's all different types of things you can do to increase your nitric oxide. So I'm going to recommend to this gentleman that he starts taking nitric oxide, because what it'll do is it'll open up your blood vessels, get more blood flowing through your body. This guy, he's actually won the Nobel Prize on nitric oxide. Unfortunately, a lot of physicians don't know about this, and this guy has done all kinds of stuff on nitric oxide. He has, I took it this morning before I went in. It's this little powder you put in there, you drink it, gives you nitric oxide, gives you more energy, gives you more this, gives you more of that. You guys have probably heard about beets doing that. This is even more powerful than beets. Beets increases your nitric oxide. So we can hopefully get you off of these blood pressure meds. I have a whole protocol for this, how to do it. I have other types of things you can do called blood flow restriction training that also opens up your blood vessels. So there's ways of doing it naturally where you don't have to be taking all of these medications. And you know, the co-pays are getting higher and higher and higher. And again, there's ways of doing it naturally. So we covered that. I got the insulin resistance. We covered that. Be careful about, again, with the hypotension, because you can wind up again getting your blood pressure too low. You wind up falling down, and you got to keep track of this stuff. So takeaway: make sure you get your blood pressure tested in the morning first thing. Give yourself at least 1 minute before before you take it. Email me, philgeorge@charter.net. If you got lab work, we can go review the lab work with you. Get the first consult is free. If you want more information on that, I can sit down with you or do it, through Zoom or whatever. I meet with all the clients either at their house and things like that. Look over the lab work. My last client, I went through his whole refrigerator, his pantries and stuff like that, and looked into everything. So, we can do a complete assessment. I'm a personal trainer. You don't have to get a separate trainer. I can train you. Training also helps with blood pressure, getting the blood flow and things like that. So we're coming up to the end of the show. Again, feel free to email me, philgeorge@charter.net, or go on your browser, Wellness Wave Radio. All my stuff is on there. And I teamed up with Kelly Hamilton. She's an ICU nurse. She's a holistic nutritionist. We do seminars together. If you want to give a seminar at your senior center or at your place of work, let us know. Come out there. We can do a seminar for you. So that's kind of it, guys. So it's the end of the show, and we'll see you next week. Thanks. One of the most common questions I'm asked as a biochemist and health coach is, what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend, with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net, for a free consult.